You know how a cough can sometimes just be a cough, a minor annoyance that passes quickly. But for those living with chronic obstructive pulmonary disease, or COPD, understanding when a cough goes from typical to serious is absolutely vital for your well-being. A severe cough with COPD is typically indicated by a significant change from your usual coughing pattern. This includes coughing much more frequently or intensely, producing an increased amount of mucus, or noticing a change in your mucus color to yellow, green, or even blood-tinged. Other key indicators are new or worsening shortness of breath, chest pain, a fever, or feeling unusually confused or disoriented. These specific changes are red flags because they often signal a worsening of your COPD, commonly called an exacerbation or a flare-up. A dramatic increase in mucus, especially if it is discolored, strongly suggests a new infection has taken hold in your lungs. More frequent or intense coughing, coupled with worsening breathlessness, means your airways are likely becoming more inflamed and obstructed, making it much harder for you to get enough oxygen. A fever indicates your body is fighting off an infection, while chest pain could point to other serious complications. Furthermore, confusion or disorientation can be a sign that your body is not getting enough oxygen, which requires immediate medical attention. If you experience any of these symptoms, it is important to act quickly. Reach out to your doctor or healthcare provider right away. They can guide you on the next steps, which might include adjusting your medications or prescribing antibiotics if an infection is present. Following your personalized COPD action plan, if you have one, is also crucial. Remember to use your rescue inhaler as prescribed, and continue to monitor your symptoms closely, noting any changes to report to your medical team. An excellent tip is to keep track of your daily symptoms, especially your mucus color and quantity, and your breathlessness level. This detailed information can significantly help your doctor make an accurate assessment. Also, having a written COPD action plan prepared with your doctor beforehand is like having a roadmap for emergencies, telling you exactly what to do when your symptoms worsen. Being proactive and knowing what to look for transforms worry into empowerment. Recognizing the signs of a severe cough and acting quickly ensures you get timely care, helping you manage your COPD effectively and ultimately breathe easier, maintaining your quality of life.